reason that surgery is not the battery in terms of battery life. Well, we can monitor it. It's something when you routinely saw your doctor, we would check up on that. It's not like if you leave the lights on the next day the bulb is dead. It takes a while longer than that. So we have a general idea. We know in advance because we're programming you what your voltage is. And I know if your voltage is this, that we're talking roughly 5 years. So I don't need to take a peek every couple months. And the battery even gives us a % of life that's used, so we can kind of extrapolate from that. Yes, sir.
There's a certain percentage of the population, almost from birth, that they've exercised and had a good diet. Does some of those people still have Parkinson's?
Absolutely.
Is it a lower percentage, or?
I don't think there's anything to suggest it's a lower percentage.
Doctor, you have noticed some left side slip?
Yes.
For a person beginning there without...
Absolutely. Turn on this mic.
Excuse me. The acoustics are breaking down as people are leaving. We have a lot of good questions. I'd like to ask Dr. Bajaj to come to the front of the room and take some questions with Dr. Snyder. And I'll ask the doctors to repeat the question so everybody can hear it. Dr. Bajaj, I'm not sure you're still in the room, but so let me give the mic. Here she is.
Here she is.
So are there any additional questions? I'll try and repeat them and refer them.
So she had started. She was asking.
Sorry, why don't you...
So the woman in the plaid scarf was just asking about whether the onset and progression of Parkinson's disease is variable. Correct me if I'm wrong. I'm repeating your question. So, and again, I'll call up the real movement disorders expert up to the microphone. But so it's absolutely variable. It's variable in that some people will have it on one side and it'll worsen a lot on that side, and then they'll develop it on the other side. Some people it will be more symmetric, and the time course is very difficult to predict. Well, what we've learned from experience is that it will worsen, but we can't draw a roadmap for you or anyone as to when you'll get from point A to point B to point C. I guess some people like to know those things. They like to plan their lives accordingly almost. Unfortunately, it's very variable, and some people will sort of be chugging along for a long time and then will start to get a lot worse. Other people will worsen right away, and other people will have a very steady, slow decline in function. But I'm not aware of any good way of predicting that.
I was interested in the deep brain stimulation, but I saw the counterindications. I had a stroke about 5 years ago, and there's damage to my brain as a result of taking Vioxx for arthritis. And they said that I had some small strokes after that. Would I be eligible or not eligible?
The short answer is absolutely. So having a stroke is not a contraindication to surgery that I'm aware of. But she didn't. She said a stroke from Vioxx. So I don't think there's a contraindication. We would have to look at your MRI though, depending on the structures we're talking about. Well, we would look at the MRI. So the short answer is I don't think that there's a contraindication. Surgery might be more challenging, and you might, and again, you're asking from the audience without us having examined you or looked at the MRI, and it might mean that we would not be able to give you the same guarantees of outcome that we would. No, there's no guarantee. It's not like that, but we know from experience in patients with Parkinson's disease, et cetera, that you get a threefold improvement in your motor function. I don't know that I could tell you that, but that doesn't mean that I wouldn't think you would benefit.
Thank you.
Certainly.
Just want to point out, there's two awful signs on the horizon. Well, everything is political, and with the new administration, they are making stem cell research and gene therapy among the highest priority order in the health programs after getting health insurance. And the other thing is, unfortunately, Michael J. Fox, as you all are aware, has developed Parkinson's, but that sort of makes him a poster child and makes the American public and the world much more aware of a disease about which they had very little recognition prior.
Without a doubt. So Michael J. Fox actually had a couple operations, the final one being subthalamic nucleus deep brain stimulation. Are there any other questions?
How quickly does it progress? I mean,
The disease?
In a field. Yeah.
I'm not, I don't.
I mean, from the onset.
Parkinson's disease?
Yeah.
I have to defer to Dr. Bajaj, but again, I don't think that there's a good predictable time course. You know, some people will need very little medication for decades, and other people will very quickly find that there's not enough medication out there to take care of them. So that's a little complicated. So typically what we think is the best predictor. So the question was, if the doctor isn't sure if you have Parkinson's disease or a Parkinson's-like disease, will surgery help? It's a little complicated, but so the answer is this. If you're benefiting from levodopa, we usually think that that's as good a test as any that you actually have Parkinson's disease if there's nothing else on your MRI to suggest anything else. And in which case, I would say that surgery would help. If you're not benefiting from levodopa, it doesn't matter what they think you have in terms of surgery. At that point, I would say that surgery would not help you, whether it's Parkinson's disease or a similar type of disease. Is there any other questions? Okay, well, thank you all. We appreciate you coming. You know, we would be honored to take care of anyone in terms of any of your symptoms or anything else, and I think all our cards and other information is available.
Well, I'd like to thank Dr. Snyder and Dr. Bajaj for an excellent seminar. Thank you very much. Thanks for coming. Thank you.